This is Group A3, and we are covering Proteus Digital Health. Proteus Digital Health was a healthcare technology company focused on developing digital medicine. It specialized in creating ingestible pills that, when swallowed, were activated and sent data and information to your smartphone via Bluetooth. Proteus referred to these pills as smart pills and was a pioneer in the digital medicine industry. The pill was created in an effort to track non-adherence to a medication regimen for patients diagnosed with illnesses such as heart failure, bipolar disorder, and dementia-related psychosis. Having raised close to $500 million and once valued at $1.5 billion, Proteus Digital Health was considered to be the next unicorn of Silicon Valley. So what happened to Proteus? On June 15, 2020, Proteus filed for Chapter 11 bankruptcy, ultimately selling all of its technological assets and intellectual property for only $15 million to strategic partner Otsuka Pharmaceuticals. We believe poor execution and a number of strategic faults led to the downfall of this once high-flying startup. I'll now hand it over to Rushi to discuss the firm's industry and major competitors.
Thanks, Charles. By utilizing Porter's 5 forces, we determined that Proteus Digital was situated in an industry with a low level of competitive rivalry. Initially, Proteus was able to gain first-mover advantage since there were no substitutes available for consumers to purchase, since this was a nuanced technology. Over time, it was determined that there was no difference between consuming Proteus's product, which consists of a smart pill and medication, versus the regular product, which only consists of the medication. Thus, there was no unique value proposition that Proteus was able to provide for its consumers. There was also a high threshold for barrier to entry in this industry, since there was a steep learning curve with significant regulatory challenges for any new firms. A stark amount of capital was also required to enter this industry, as shown by the $88 million in funding that Proteus received from Otsuka, and yet still needing an additional $100 million during their funding round in 2020. Overall, Proteus had been able to accumulate $100 million to $500 million worth of assets in their bankruptcy filing. Finally, there was no threat of retaliation, given that there were no existing rivals. In terms of major competition, the only other player in this space was EtectRx, who created the ID capsule, which is a standard hard gelatin capsule with an embedded ingestible wireless sensor, the ID tag. Each time an ID capsule is swallowed, the ID tag uses EtectRx's proprietary communications technology to transmit a very low-power digital message from within the patient's stomach. Now, I'll pass it over to Evan to speak about our pest analysis.
As an ingestible sensor to track medication taking behavior, it's unsurprising Proteus faced harsh external factors and threats when it came to its success, or rather non-success, in the marketplace. These external environmental threats and influences derive from the political and legal, economic, sociocultural, and technological segments. For political, the smart pill maker's sensor was one of the first to receive 510 clearance from the FDA. It passed through all necessary studies and clinical trials, overcoming the pressing legal and political threats and achieving clearance to operate. In terms of economic influence, it was marketed as a tool to minimize non-adherence to medication regimens to better treat patients who particularly should not miss doses. Proteus's Abilify MySite product costs $1,600 a month, in addition to the other extraordinary costs these patients incur monthly for treatment. Proteus's attempt to extract value from individual consumers rather than pharmaceutical firms was its major threat there. The sociocultural threat is understandable. Individuals, especially older generations, did not want to ingest technology, feeling it would track them and invade their privacies. Whereas non-adherence to medication regimens is a serious matter, the individual did not find it to be worth the personal costs associated. In terms of technological threat, Proteus faced little, as it was ahead of the rest in innovation and in clearance. While the political, legal clearances were overcome, the purpose understood, and the technology was sound, consumer acceptance was a lost battle for Proteus. Patrick will go into further detail.
Proteus faced 2 key strategic challenges regarding its MySite Abilify medication. First, they were challenged to convince customers the medicine was more valuable than traditional antipsychotic medications. Their pill did provide benefits like ensuring patients took the prescribed doses regularly, and it helped patients avoid medication misuse, both of which are well-known problems regarding psychiatric illnesses. But even with those benefits, there was no research-based evidence that MySite Abilify led to better patient outcomes than traditional medication, raising questions about the value of the pill versus its lower-priced alternatives. Second, Proteus was challenged to overcome the inherent skepticism many customers held towards tracking technology, which made it difficult for the company to convince patients to adopt their medication. There were also broader social challenges that raised questions around what patient data would be collected and shared with third parties, whether providers would attempt to use tracking technology to control patient behavior by tying prescription adherence rates to insurance coverages, and how patient freedom and autonomy in their care decisions could be eroded. All of these further challenge Proteus's ability to successfully market their technology. Next, John's going to share the conclusion in future lessons.
Future entrants into the medical startup space can derive several vital lessons from Proteus's failures. Firms, especially cultural competitors such as AttackRx, would do well to alter their behavior so they can avoid the same fate. Proteus suffered from a desynchronization between its revenue source and its target audience. Pharmaceutical firms saw great value in Proteus products, which helped to mitigate the estimated $250 million a year cost associated with patients not following medication schedules. Proteus used end consumers as revenue drivers rather than those pharmaceutical companies, and those regular consumers did not see the value in paying significantly more for the service that Proteus offered. In a VRIN framework, Proteus's key resource was rare, inimitable, and non-substitutable, but to consumers it wasn't valuable. Proteus' position as a different but not differentiated service had deeper concerns than just revenue mismatch. Its targeted segment, consumers suffering from dementia, schizophrenia, and bipolar disorder, reacted negatively to Proteus's business model of tracking users with a smart pill. Proteus was unable to overcome this bias. Finally, Proteus proves that money is not a solution for startups with poor strategic vision. Despite Proteus' significant fundraising, its strategic partnership with Otsuka Pharmaceuticals, and its valuation over $1 billion, was unable to maintain a position within the healthcare space. Tech startups in the healthcare space would do well to heed these lessons that can be derived from Proteus, that a unicorn status is not a sufficient shield against market realities.